Again, please turn on your camera. Okay. Palihog lang. Okay, so kanang wala gadita ra, okay ra lang gadita. Pero si Mark lang. Uy, ikaw Pedrosa, sige ka gadita Pedrosa eh. Okay, so unsay tawag ani? Kada naa na ba tanan? Sure jud ka habil. Naa na tanan. Nasa na sila di man pag 20. Okay. Interns Miss Sanchez og Rubik. Oy, may buntag na Miss Rubik. Bago pa nga matara. Okay, si
Morning, sir.
ano mas Miss Sanchez? Miss Sanchez, my friend. Where are you? Okay, so okay na tanan. So majority kay naa naman siguro. Sige, okay ra joke ra to gadin eh. Kanang if ever nga gadita ra mo, di gadita ra mo. Okay, so interns kanang if ever you're ready, pwede na mo mag-start ha. Sige. Okay na. Bahala de. Okay ra. Okay. Miss Sanchez, Miss Rubik, kanang ready na mo start.
Makita ra, guys? Ang PPT. Okay, sige. Kita ko na yung nag-thumbs up. Okay, so good morning, everyone. Today we'll be discussing the OT process in telehealth. So for the report outline, we have first part 1 for the OT process in general. We'll be defining what the OT process is, and then unsa iyang flow. Also part 2, evaluation, and then followed by intervention, and lastly, the outcomes. Okay, so for the OT process, this is actually here occupational therapy practitioners attend to each aspect and gauge the influence of each on the others individually and collectively. So by understanding how these aspects influence each other, practitioners can better evaluate how each aspect contributes to clients' performance-related concerns and potentially contributes to interventions that support occupational performance. So in short, atong OT process kay morning part na makahatag tag evaluation sa atong clients and also give management to them. Okay? So again, OT process is a process undertaken by OTs when providing services to clients. So this is a client-centered delivery, and its focus is the use of occupations to promote health, well-being, participation in life, and achieving occupational balance. So it follows the universal plan for problem solving. So first, we have identifying the problem, determine the possible solution, we intervene, and then evaluate the result. So ang OT process kay it does not occur in a sequence step-by-step fashion, rather it is fluid and dynamic. So it allows us, kita mga OTs, to maintain the focus on identified outcomes while continually reflecting on and changing the overall plan to accommodate new developments and insights along the way. Okay. Sige, so here we have the OT process, no? So, masayo ni siya i-understand kaning part. So, first we have evaluation. So, evaluation, napamanay referral o kanang screening, and then followed by the occupational profile and then the analysis of occupational performance. So, tanaw ninyo, asa man ang makita ato ang OP ug ato ang AOP? Sige, type lang or off mic lang mo guys para mas dali. Okay, sige, very good no nga eval, but unsa man na form atong i-use for that one, na occupational profile ug analysis. I think we are all familiar no kay nakapidya sad mo. Yeah, sige. So sakto no nga sa IE nato makita nato ang occupational profile and the analysis of occupational performance. Okay, very good everyone. And then followed by intervention. Mo atong intervention plan, intervention implementation, intervention review, and then lastly our outcomes, which will also be discussed later on. So first we have our okay, kani siya kay mas detailed ni siya nga process. So first we have from the physiatrist. So murag ka ng general assessment lang, and then screening for rehabilitation services such as PT, SLP, and OT. And then medical prescription or referral from the doctor, and then endorsement to the OT unit. So kaning OT unit, mas detailed ni siya karon. For the OT unit, we have the screening, registration, the scheduling and decking, the evaluation, intervention planning, intervention implementation, re-evaluation, discharge planning, and discharge. Okay? So now we proceed with the evaluation. Ano? Okay. So, tanaw ninyo guys, unsa may involved basta mag-evaluate sa atong client? Unsa man atong i-do besides interviewing them? What else do we give man to our clients? Okay, very good no. So, functional assessments and as well as mga assessment tools. So, kana, mo na ato adjud kita mga OTs need na to og assessment tools para mas makagive ta og better management and intervention for our clients. So here, evaluation is the process of obtaining and interpreting data necessary for intervention. So it begins with the physician's referral and screening. So for the evaluation, again, mo start ta og referral and screening. So kaning referral, this is the point at which initial request for services for particular client at a change in the degree and direction of services made. So kaning referral, it can be done through self-referral or referred by physician or another profession or another agency. But usually kita OTs, ang atong referral gikan yun sa mga doctors. So typical information addressed in an OT referral, we have here the client's name, the date of birth, the client's phone number, the primary or medical diagnosis, secondary or therapy diagnosis, the reason for referral, frequency and duration, the physician's name, and lastly, the date of referral. So kani, we have here a sample referral. Maklaro ba guys? Medyo blurry lang yun siya, no? But this is how it looks like for kanang mga referrals. It will depend na sa unsa say template sa mga doctors, no? So that's how it looks. And then next, we have screening. So for screening, it starts with reviewing the client's medical chart or record to determine the need for further evaluation, the type of assessment tools that may be needed, and specific OT. So here we gather preliminary information about the client and check eligibility of providing OT services. So here, igo tan-awon ang medical chart or medical history sa atong client para will determine no kung need ba jud niya og OT or lahi di ay nga service no or kailangan niya, and unsay ang mga tools ang applicable sa case sa client. So mabal-an man na kung unsay tools i-use, especially if you know the medical diagnosis as well, no. Okay. So for the screening, it may involve the review of the client's records, so the use of screening tests. Okay, one also is we interview the client and as well as the caregiver. A quick observation of the client, so kana pwede ta mo hatag o kanang pwede ta mo tanaw sa client no anang functional assessment kunuhay, and then discussion of the client's referral, and then determine whether further evaluation and OT intervention is warranted and can also take place as part of the OT evaluation. Okay, so for the screening, we have situational factors. So for this one, situational factors if kailangan bigid if need gid sa client na face to face, or okay ra ba nga online siya or through teletherapy, and also if the client is a Filipino or kanang lahi siya glahi, no? So kana situational na siya kay we'll also know what type of language we're going to use or to communicate with our client. And then here, technical factors. This includes the availability of the technology and kung kay bao siya mo use sa technology, no? The device, phone or laptop or PC or tablet. Also the online platforms. If kay bao sila mo use og Zoom and Google Meet. And then lastly, dapat stable or high speed ang internet connection, no? Especially karon kay teletherapy man ta. So need jud ang stable nga internet connection para hapsay ato ang paghatag og management og evaluation sa ato ang clients. And then lastly, the person factors. So if need ba og caregiver for assistance and handling, and lastly the availability of resources. Okay? Sige. So kasabot ra guys or paspas ra kay ko. Type lang ninyo guys or pwede jud mo mag-on mic. Alam ka wow. Hyra? Oh, sige. Okay. Thank you. Sige. Sige. So, unsa may difference sa referral gani og screening? Sige, kanay. Asta mo, ana. Unsay difference between referral and screening? Sige. Manawag ko ha. Sige kani si Ruli. Participative man kay siya. Sige, can you differentiate? Sige, okay lang. No right or no wrong answers naman po. Based on your understanding. Hello? Asan po si Ruli? Sige, unsay difference between referral and screening? Sige, or anyone? Sige, ako na dito ba? So, ang referral, kay gikan sa ato ang physician. Okay, na ini-answer si Donna. Referral request for service from physician, and then screening is the gather information about the client for further eval and management. Okay, so correct, no? Okay, so to better understand, like what Donna said, referral is request for service from the physician or any medical professionals, and screening is gathering information about the client for further evaluation and management. Thank you, Donna. So next, here, it will depend actually sa center affiliation, no? Or kung asa mo na-assign na center, but gikan man ko og OT rehab. Sige, one of the centers here if mag-internship na mo. So, kani siya kay teletherapy man, so buhat siya through Google Forms for patient screening. So igo ra sila mo input or like type unsa ang ilahang dapat i-fill in. So here ang email, the language nila, name, and also the age of the patient, and as well as the caregiver, no, and etc. So ang kaning CD OT rehab kay dili ra ni siya pidya, napod sila i-FISDIS, and then karon nag-psych na pod sila. Okay, so next we have registration. So for the registration, the CS will prioritize the name of the caregiver, the name of the client, the preferred days of OT telehealth sessions, the preferred time of OT telehealth sessions, and then also need pud ang scanned copies, no? So muas na usually ka ng latest doctor's referral, the client's PWD ID, depende, or one valid ID of the caregiver, and then the results of previous tests and assessments if available. So here, sa ako ang experience kay in terms of the preferred days of OT telehealth sessions and as well as the time kay what we do here is we contact the client na or the caregiver. So we ask them no kung when sila available, like for this week, unsa nga day sila available, is it Monday, Tuesday, Wednesday, and then ang time pwede sad ta mohatag og time nila kunyari ang available slot na lang di ay ma'am kay 11 to 12, 1 to 2. So unsa may mas pabor nimo ma'am? Ingana na siya og asa inyo hang client. Okay? And then here it will depend if naay PWD ID ang client. So any ID will do and for the caregiver. Okay, here same lang no, sample lang from my previous kanang center that I was assigned to. So here is the registration form through Google Forms sa gyapon no. So mas dali if Google Forms. Teletherapy man karon. But dili kami ang gipamake, amo ang CI na nagmake ani para mas dali kay daghan jud og patients nga magsigig contact sa amo ang center and then daghan kay nasa waiting list sa. Okay. And then next, we have the scheduling and decking. So, mo na to, once nakaas na ka sa time o date, so dire na siya mo enter, no? So, ato ang CS kay siya na mo deck sa client. And then here, we'll determine whether asynchronous or synchronous and hybrid ang kailangan sa ato ang client, no? So, mo na siya ang scheduling and decking. Most likely, for the decking part, ang CS na bahala mo deck sa imong client, ikaw igo ra ka mo confirm sa client, mo ask sa client if available sila ani nga time and dates. Okay? Sabot ka guys? Sige. So karon going back to evaluation, so ang goal jud ani niya no is to complete an occupational profile of the client and as well as analyze the occupational performance. So here, the occupational profile, it describes the client's occupational history, patterns of daily living, interest, and therapy needs. And then for the analysis of occupational performance, it looks at the client's observable performance in carrying out desired occupation tasks and ADL. And then lastly, again, kato inyong giingon, ngay assessment tools, functional assessment, and also through interviews. Okay? Sige, so unsa may interview aning duha, kaning occupational profile or kaning analysis of occupational performance? Okay, so ni answer si Marky og profile og si Christy day. Sorry. Okay, very good no. So occupational profile part sa tong IE, katong first part jud na moasta sa goals, sa concern sa client, mauna siya through interview, and then for analysis of occupational performance, mauna ni siya ang pag-observe na to sa client no through functional assessment. So sa telehealth setting, it can be done through synchronous or pwede ra ta moas og video sa client nga gibuhat niya sa iyahang kanang daily routine no. Depende sa kung unsay occupation na sila concerns with. Okay, so we now proceed with the occupational profile. So, Again, this is the initial step in the evaluation process, which provides an understanding of the client's occupational history and experiences, patterns of daily living, interests, values, and needs. So the client's reasons for seeking services, strengths, and concern in relation to performing occupations and daily life activities, areas of potential occupational disruption, supports, and barriers, and priorities are also identified. So again, occupational profiles atong IE, you're all familiar, which is kanang you all are familiar with. We ask the client their goals, ilang reasons for referral, and ilahang occupational context, and etc. So yung ana na siya. Okay. Here, sa atong occupational profile sad, we observe the client's performance skills and evaluate the client factors that can interfere with occupational performance. And then, the client goals and limitations in occupational performance become the basis for developing treatment goals or objectives and strategies to remediate or compensate for problems in occupational performance. Okay. Okay, so now we have the analysis of occupational performance. So mo na ni ang lower half sa to ang IE no sa evaluation nga part before ta mo proceed sa to ang unsa gani sunod sa analysis of occupational performance sa tong IE? Unsa may naka-remember? Sige, ask na ko si Don Rose. Don Rose, tama ba? Correct lang miha if mali pag-pronounce yung names.
Hi, pwede pa repeat sa question? Sorry.
Oh, it's okay. Sige. Unsa may after sa analysis of occupational performance man? Like sa atong IE. Go lang.
The assessment part, Nia?
Okay, yeah. Correct, no? Ang assessment part mo na tong OT impression, the prioritized problem list, the rehabilitation prognosis, and then the rehabilitation potential. And then after ana mo na nato ang intervention na part, no? So thank you, Don Rose. So here for the analysis of occupational performance, this is the step in the evaluation process during which the client's assets and problems or potential problems are more specifically identified. So performance skills, performance patterns, context or environment, client factors, and activity demands are all considered, but only selected aspects may be specifically assessed. And also here, targeted outcomes are identified. So this will be discussed later on na ang kaning mga outcomes. So diri manggawas no katong mga client factors, makita nimo hala unsa nga client factors ang affected ani sa client no o kaning mga performance skills. So atong performance skills mo ning atong motor, process skills, and our social interaction skills. Okay? So it will also depend on the client's case. Dili kailangan na tanan no skills ibutang didto maski walay problema ang client ana nga area. So here, as you can see, we have here the occupational profile and then the analysis of occupational performance. So sa atong OP, kay we identify the following. So why is the client seeking service and what are the client's current concerns relative to engaging in activities and occupations? In what occupations does the client feel successful and what barriers are affecting his or her success? What aspects of the context or environment does the client see as supporting and as inhibiting engagement in desired occupations? And here, the occupational history, yung values and interests, yung daily life roles, patterns of engagement in occupations, and etc. As for the analysis of occupational performance, here they synthesize information from the occupational profile to focus on the specific occupations and contexts. Mo na bitaw maka-identify dayon ta which unsa nga functional assessment atong mag-give sa atong client once mabal-an gid nato no kung unsa ilahang concerns. So kunyari if mo ang concern sa client kay maglisod siya kanang ilis, of course ang imong ihatag nga activity kay dressing sad na part. But it's also up to your clinical reasoning, no, as OTs, kung unsa pay lain occupations ang dapat ma-target, even though wala na mention sa client or caregiver. Okay? Ano na siya, guys. Okay.
Okay, so after nato mag-evaluate, of course, atong i-make use ang ato ang mga nakuha nga information, no? This is done or ma-apply nato sa atong intervention process. So, ang kaning intervention process kay nag-consist ni siya og mga skilled services provided by OT practitioners or mga training OTs in collaboration with the clients to facilitate engagement in occupations nga well-being and also participation. So there it's kanang highlighted no nga dapat in collaboration siya with the client kay of course dili lang ang atuang like reasoning ang atuang mahibal-an dapat in or atong i-apply dapat when providing intervention for the client but also unsa ilahang desired goals, unsa ang meaningful para sa ila, unsa ang importante para sa ilaha. So, in short, ang kaning ato ang intervention rag more on the client information nga atong nagather during the evaluation in addition to the theoretical principles na mo direct sa ato ang intervention. So, ang atoan nang i-apply dira ang katong mga frames of reference, mga approaches to OT and the likes no so para ato ang mabuhatan og kanang sakto nga occupation-centered interventions ang client. So, next, Mikhay, please. So, depending on ato ang client, so it can be a person, group, or population. So, natay lahi-lahi nga types of OT intervention. So, mao ni siya no ato ang mga occupations and activities. So, mao ni ang ato ang naa sa ato ang mga O part and P part. So, usually atong occupation and activities is kanang nag-target gyud sa unsay kinahanglan sa client. So, mga selected interventions ni siya to meet the specific or needs sa ato ang clients nga naay mga therapeutic nga goals no nga gimit and address sad ang ilahang underlying needs. So, can somebody tell me unsay kalahian sa occupations o activities? Sige, I'll call someone. Mark Ledesma.
Activities are like
Hello,
smaller
Marky.
parts.
Sa occupations and okay.
Hello.
Madungog ka, Marky.
Okay,
Sige,
okay.
go.
Activities are like smaller parts of occupations, I think. Like a specific certain activity or part of an occupation, then occupation is meaningful activities as a whole. So for example, siguro your occupation is like cooking or meal prep, then your activity can be boiling an egg or cooking a specific type of food. Yeah.
Okay, sige. Thank you, Markino. That's good na nag-give po ka og example. So, sakto si Markino. So, more on components niya ang activities sa ato ang occupations. Walang occupations, mao na gid nino kanang it's the bigger picture, no? So, mao na ni ang nag-address na gid ta og identified na goal sa client. So, for example, when you're trying sa, another example would be like if mag-teach ka sa client og like let's say mga getting or kanang mga pag complete og morning dressing and ana so your activity can be part na ana mag-select ka og mga sanina nimo na gamito or sanina sa client na gamiton niya for the day. So it's more of like a chunk of your occupation ang imong activities as long as silang duha kay interrelated sa each other, so connected sila in order nga ma-complete niya ang or ma-achieve niya ang sa client. And then next we have the preparatory methods and tasks. So from the name itself, no, it prepares the client for the occupational performance. Now, manawag na pud kog someone para maka-differentiate no unsay kalahian sa methods and tasks, and then give sad og example if pwede. Sige, Sofia Habel. Hello? Or si Paula Alano. Nara si Paula Alano. Hello? Sige. Unsay methods or tasks? Aniwan na lang. Okay. Sige. It's okay. Sige no, so ang preparatory methods, more on ang practitioner mo'y maghimo no. So mo ni siya mga splinting, assistive technology, mga environmental modification, and wheeled mobility. So there is atong preparatory methods, ang ato ang practitioner mo'y let's say sa kana ato ang mga kuano, mga cold compress, hot compress, mga TENS, inana. So, kanang inyuhang 313 nga lessons yun, more on, appeal na siya diri sa preparatory methods, no? So, kana inyong mga paraffin wax, inana. So, appeal sa na siya diri, and then inyuha pod splinting, which is under your 313 also, kana inyong mga hand splinting, mga AFO, and preparatory methods. Now, when we say task, it's more of the client na. So, ang client na gyud ang mubuhat sa action, no? Like, mga, let's say, magbuhat sila hand strengthening exercises, kana inyuhang mga PROMs or passive range of motion exercises, and your active range of motion exercises. So, there's a lot or kanang wide range ni siya nga daghang kapilian depending on what the client needs ug unsa inyuhang activity for the day. So again, on the practitioner nga administered activities, or mo recommend ang practitioner og mga supports like visual supports or let's say assistive devices for the client, while ang preparatory task is more of the actions made by the client himself or herself. So next, we have the education and training. So, kato pa mi kay, sorry. So, diri ang ato ang educational no, cause mo ni siya atong buhaton for the clients at the end of the session, or even kanang sa end na gyud sa ato ang like kanang pagkita sa ilaha. So when we say education, very very simple no, imparting knowledge and information regarding sa ilahang condition, sa ilahang progress, and um, how they can pursue their progress no, or kanang continue their progress even at home. So ilang habits, routines at home in order nga ma-continue ilang progress and wala sila decline na mabati. So mga education about the strategies and ana. So when we say training, it's more of kanang acquisition of concrete skills. So diri instruct na ang therapist no, in order to know unsaon pag-control sa wheelchair, or kanang when bag-o pa unsaon pag use sa mga those things na practical na gyud na ma-apply nga skills sa mga clients in order for them to be able to do those things at home na pod, and matarong and appropriately done nila sa ilaha. And then next, we have advocacy. So there is advocacy, more on us na po din, no? So efforts ni undertaken by the practitioner. So it's either we like collaborate with other people, mga when we services na like so we need to advocate for their rights inana, and then connect with people nga na ay better knowledge about it than us. So sometimes no na yung mga lawyers inana, so we need to support them in ways na ma-accommodate nato ang ilahang kinahanglan. So aside from that, other examples would kay we collaborate with and educate mga staffs under their working conditions inana. So more on advocating for their maka-fully participate sila sa ilahang daily occupations. Now, when we say advocacy, naapod under it ang self-advocacy. So, it is not enough no nga, kita lang gid ang, it's not that empowering if mostly kita ang mo undertake sa advocacy. So, we should also teach clients na maka-learn og self-advocacy. So, in here, more on the client na ang mo do or mo make sa ilahang own nga progress in order for them not to have or to fight for their promotion and support. So for example no mga young adults contacting internet service provider to request example na ay cyberbullying na ma-happen. So para pud ilang ma-practice no on how to protect and support themselves. So next, we have the group intervention. So ang kalahian anino is that we facilitate the learning and skill acquisition a group. So usually when I say group, of course daghan siya nga ang client. So pwede ni nato mabuhat no with the use of mga functional activities or activities groups, mga social groups. So when we say concrete example, mga older adults baron nga ato ang i-gather together para makahibaw og mga fall prevention, mga people with mental health conditions nga maka-establish on or pagbalik sa community inana. So more on those things ang under sa group interventions. So next, okay. Okay. So ang atong intervention process na ani siya tulo ka steps no. So una ang atong intervention plan followed by our nara tay plano but wala tay action towards it, and then of course our continuous intervention review. So ari sa ta sa intervention plan no. Okay, next please. Okay, so sa intervention plan, mao ni siya ang mo-direct sa action sa OT practitioners o sa mga aspiring OTs para maabot ta sa atuang desired outcomes. So it depends no kung unsa atong ganahan nga outcomes. This is developed with the clients or give me an example kung kanus ata mag-develop og intervention plan with the client's proxies and dili gid ang client mismo. Sige daw. Example or sample situation wherein sa proxy ta mag or sa caregiver ta mag collaborate and not sa client himself or herself. Si Sofia Christine Uy. Sige. Or bisan kinsa nga ginahan if wala si Sofia. Sige na, important ba ni siya guys kay dili ba sa tanang panahon no na. Okay, sige. Thank you, Marky. Who else pa man? Kanang wala pa questions. That's right na if dili gid nila makaya ang ilahang koan, ilang own like wala. Yes, comatose patients, media. Okay. Thank you everyone. So sakto no. More on magkuha na ta or mag-collaborate ta with the caregivers and proxies if the client cannot like does not have the ability no na iyang ma-take care yang self, wala siya sa right state of mind, and also kanang minor pa ang client. So thank you everyone for answering. So ang atoang intervention plan is directed by many factors. So first, of course, very important, centered ta ang client's health and well-being jud. So unsa kumusta sila, how they are coping up, unsaon nato pagtabang sa ilaha, and then also ang client's performance skills and patterns. So we should also know kung unsa atong i-target ana, how we can perform intervention implementation based sa ilahang routine, sa ilahang habits, unsa ilahang roles, inana. So dapat pud na nato i-consider. And then also the collective influence of the context, environment, mga activity demands, and the client factors. Kay para pud mahibal-an nato no if again unsaon nato pag-target sa case sa client. So collective influence of the PEO. And then next, we have the context of service delivery. Kung unsaon nato paghatag no. So this was discussed before. Unsa man face-to-face, hybrid, synchronous, async. So that would also matter. Kay nabay uban activities na that can't be done at home lang yun, especially if dili pa kay knowledgeable or orient himself a bit. So again, we must ensure their safety as well. And then next, we have the best available evidence. So this is why right now, gina-practice gid no nga mo find og mga journal summaries and ana mga journal related to the conditions nga atong i-discuss. So I know it's kinda kapoy usahay na mag-summarize og journal, magbasa og journal. Pero it's very then mabuhat siya og good sa atong client. So by reading mga journal summaries and then also applying it to our intervention plan can also greatly help kay mao man na siya ang mo-direct nga or mo support nga sakto ato ginabuhat sa ato ang mga clients. And then nani steps atong intervention plan. So first, pag-develop ta og plano. So include ni siya og mga objective and measurable goals, di ba? Giingnan na taon sa tuman when making goals. Sige daw. Unsa ito? Let's si Pedrosa Therese. Unsa angay hibal-an gali ig magbuhat og mga goals katong mga Therese Pedrosa. Therese. Sige lang, no? Basin, hinay ang net, aritan ni Molet Alforque. Molet Alforque. Sige, tayo ang hinumduman if magbuhat o goals. Okay, sige, last na. Last, si...
Yes, kato tong mga format like A, B, C, D, ana, na goals.
Pwede, kana pod, and then, unsa tong isa katong smart.
Katong
Sige,
smart.
unsay meaning smart. Sige. Can you tell me unsay meaning gali sa
Specific, measurable, achievable, realistic, and anchored within a time frame.
So, dapat nun when we develop a plan kana kung kaya na to ma-measure balaan if naabay progress or wala kay lain pud a plan or goal and then we don't know if moving ba forward towards our goal or not. So important din na when making a goals, we must apply katong mga concepts na sa ato before, no? And then next, we must also consider the OT intervention approach. So katuno mga either creating, establishing, restoring later on, and then the service delivery again, and then of course consider potential discharge needs or plans. So dapat sa sugod pa lang kay baw na ta kung unsaon kani siya ang mga potential nga pwede ma-end ani nga atong sa no example if kaya pa ba niya jud na by discharge kaya ba niya mo improve, kaya ba niya i-maintain nga iyahang kakayahan. And the next, we also recommendations or referrals to other professionals if needed. So that's also part of our intervention planning, no? So let's say na nahatagan tag client and then based on our clinical reasoning, kailangan gid ta og help or kailangan ta mag have a like multidisciplinary action no sa kana nga client, so we can call on or refer the client to like mga speech language nga pathologist in order for us to help the client better. So there are some things man good na dili nato mabuhat jud alone as OT. So that's when we call the other order for us to help the client improve or optimally improve jud. Excuse me. So next slide please. Now we'll talk about the OT intervention approaches. So when we say create or promote, sige, let's call again. Let's call Ethan Bermejo. So can you tell me say meaning sa create or promote nga approach to intervention? Sige, Ethan Bermejo. Sige lang. Sige, anak ko si Ruli Cuerpo. Okay ra if, sige. Cuerpo, unsa ang, can you define what is create or promote in the approaches to intervention? Yeah. Sige, Cuerpo. Ruli. Okay, sige. Sige lang, no? So, kanya lang, you can chat sa inyuhang Google Meet, no? When we say create or promote, does it assume a disability or walay disability? Okay, sige. How about ang uban? Okay, not assume. Okay. Sige, not assume. Sige. Let's call Sophia. Sige daw. Since it does not assume a disability, can you give me an example, no? Nga example of intervention nga nag-use or create or promote or more on how approach. Okay. Sophia Christine Oy. Okay. Make a fall prevention plan. What else? Sa pa-
Since create and promote tayo, ma-focus mo siya of enhancing performance. So, mga more on prevention siya, kaya wala pa may, we're not assuming the disability of the client man.
So, Gida, can you give me an example of kanang nags og health promotion na approach to intervention. For fatigue management, can be no, pero usually dili siya applicable kay when we say fatigue management, kanang under ana more on na sila problems with their fatigue. So nag-assume na taog disability. So other examples lang no, aside from your fall prevention sa mga senior citizens and then mga parenting class sa inyuhang barangays, you can also use, okay, kinsa to naingon og stress management, that's right no, kay dili baya tanan nga pwede baya tanan na naay stress, di ba nga mabati, but that does not present na nanatay disability tungod sa stress. So we can all experience stress, but this does not mean nga nanay disability ang client. So we can also do that mga stress management na mga sessions sa barangays baron or sa working areas, and then we can also do mga vocational activities sa barangays kay dili siya need no or walay disability tanga gitan-aw, but we're more on from the name itself, we're more on creating and promoting the health of our kanang clients and even the other people nga walay disability. So again, no, when we say create and promote, wala siya nag-assume og disability. So when we say mga stress management, it's very general and everyone can join. And then mga fall prevention, mga vocational activities, and then even mga leisure activities, no? So pwede ta magpa-paint or mga painting activities sa mga all people or all ages sa atong barangays or communities, and then that can fall under the health promotion nga OT intervention approach. And then next we have establish or restore. So diri no, we establish or restore skills or ability na wala pa na develop or kanang nawala sa client. So sige daw, can we have Mary K. Celine Gabiana to give an example kung pwede magamit ang establish and restore nga approach to intervention. Hello?
Pwede ba katang like giving out, like establishing kanang exercise program sa mga diabetic?
Unsa man ang imuhang gitry og establish or restore nga skill?
Like for health management, niya ang exercise plan ang pinaka-intervention, something like that.
Okay, sige, thank you for answering mo. Sige, so, pwede ra siya, it's okay. So, thank you for answering. So, pwede ra siya if example ang diabetic client no kay nakuwangan o kanaang or na lessen ang iyahang endurance because of iyang condition, and then that's when we develop mga programs para sa imong giingon na mga low impact sa para sila makalitan, and then as much as possible no mahinay-hinay na to og restore ang ilahang nawala na function if kaya pa, but very kanang very nato nga example no kanang mga client nga CVA na stroke or kanang mga na fracture na client, di ba, at first kay wala gina sila, let's say wala gina sila umoy sa ilahang kamot or di gina nila ma-move. So in order for us to restore ang ilahang nawala or na-impair nga ability, that's when we make na mga exercises no, mga PROMs, hinay-hinay na to makita na unti-unti na restore nila ang ilahang ability to move their shoulder, move their arm. So that's one of the example na makita gid nato. And then also for autism clients, they to have a very important for autism clients. need nila og, yeah, that's right, thank you. Need nila og kanang routine, di ba? Para mas it helps them calm down. Okay, thank you, Crispy Pod. It helps them calm down para makahibaw sila no kung unsay structure sa ilang day, kung unsa ang flow sa ilang adlaw. So that's also part no mo establish ta og structured schedule for them. So another one is that we collaborate with clients no to help them with their routines and ana. So that's more on establishing and restoring. Now, let's move on sa maintain. So, when we say maintain, di ba, very understandable po na ato lang i-preserve ang ilang performance or ang ilang capabilities na regain. Kaya, di ba, you will agree with me that there are some conditions or dira ra gyud kutob ang ilahang makaya or ilahang ma-improve. So, ang ato ang mabuhat is for them to be able to still perform their occupations despite nga mauna lang ang ilahang makaya sa ilahang so example from let's call Felshine. Can you give me an example, Felshine, of kanang OT intervention? Sige, Pedrosa. Or
Okay.
Shine lang sa.
Sige, kaso lang nga, ongoing intervention and doing follow-up sa client if na-do ba nilang activity.
Okay, so can you give me like kuan one concrete good nga example like unsa nga disease or unsa iyang problem and then need na lang siya i-maintain?
Ano mo try?
Sige, Therese.
Kuan.
After Therese kay si Talsha na to. Therese.
I-maintain ang gardening skills for persons with arthritis through mga modified tools like kanang pang-grit nila and mga long-handled equipments or like raised gardens para mas easier for them.
Okay, sige. That's right no. So, despite sa ilang condition kay ato gihapon maintain na kaya nila na mubuhat alone sa ilahang own nga ilahang own na makaya. And then Donna Jane said provide intervention sa mga sige, thank you Therese. That's right no. And then provide intervention sa mga muscular dystrophy patients nga mo participate. Okay, that's also one. And then timer medication schedule for Alzheimer's. Okay. Pwede po na no para ilahang mabuhat ang ilahang activities independently despite their condition. However, ang kaning timer for medication can be also applied sa ato ang next nga approach to intervention. Sige, so maintain no, aside from those examples nga inyong nahatag, we can also use this no mga old people. So, di ba, usually di naman gina nato sila ma-improve because part of aging is ato ang pag-decline functionally. So, para ma-prolong ilahang independence or mas ma-independent sila despite their old age, we must be able to help them maintain kung unsa ang ilahang makaya na mga buluhaton in order to preserve their performance o capabilities. And then, for some pod no, let's say some SCI patients na nagid sila permanent damage or kanang dili na gid mabalik or restore ang ilahang abilities or function no kay totally naguba na gid ang ilahang function in those areas. So ang atong mabuhat na lang gyud is to make use of unsay nahibilin na abilities or skills nila and then ato ang i-try og so atong i-prevent no na mag-atrophy ilang muscles kay dili na nila ma-move atong let's say magka-contracture sila so mas dili na noon nila ma-move. So ang ato ang mabuhat is to maintain kung unsa ang naa sa ilaha as of unsa ato ang makaya in order for them to still be able to independently perform their occupations. Next, we have modify. Sige. Okay, hindi na ilaya. Sige. So when we say modify, no, it's more on finding ways to revise current context or activity para mabuhat gyapon sa client ang ilahang buluhaton. Sige. Sa under sa itong modify natay compensate and adapt. Kinsa may maka-differentiate sa compensation or adaptation. Buff Paraguya. Can you tell me unsay difference between compensation and adaptation?
Ang compensation miss kay use og techniques and strategies para makadu siya sa certain things, while ang compensation is kanang mag-find og other approach.
Sige daw. Pwede ka mo give og one example under adaptation and one example compensation. It's okay. Unsa man to? So, di ba, niingon ka ang compensation more on finding para makabuhat ang client sa iyahang activities. Kaha ni mga pwede activities, examples nga nag-change ka or naghatag ka og technique sa client.
Like for example, siguro miss kanang sa compensation, miss kanang like mga one-hand technique for dressing, ana miss.
Okay, sige, sakto no. So, mga hemi-dressing technique. So, unsaon niya pagbuhat sa dressing despite her inability to move the one side sa iyahang body. So, that's also one example under compensation. So, when you say adaptation, unsa man imong mag-give nga example under adaptation? Let's say dressing gihapon or any lang activities.
Kanang for example, siguro kanang i-modify ang steps sa dressing.
Can be. What else pa man? With the use of your very common mga okay, pwede cues, no? Yes, okay, that's right, adaptive devices. Sige, thank you, Bob, Joseph Paraguya. So, sakto siya, no? So, when we say compensation gali, more on teaching the client techniques or strategies in order for him or her na maka-accomplish gihapon sa activities despite sa iyahang limitations. So, when we say adaptation naman, more on helping the client no nga mahimo ang activity easier. So, pwede na siya through mga environmental modification, mga use of mga equipments or mga things nga makapahimo sa client sa iyang activities nga nanatay something sa iyahang environment. So, mga examples lang no or other examples under compensation aside sa katong one-hand dressing, pwede po ta sa mga clients nga difficulty na sila no in managing their kakapoy. So, energy conservation techniques. So, para ni mabuhat nila ang ilang activities with the use of katong pacing, mga planning, prioritizing, and ana. So, that's also one example under compensatory. And then, you can also have the use of mga techniques. So, complete og task. So, when the client has CVA, saan niya pag mo og mga kitchen activities or meal preparation with the use of functional use of one hand lang in ana. So that's more of the compensation. Now when we say adaptation, mao na ni siya no mag-restructure na ta sa environment, mo change data sa activity or mo modify nata sa activity, and then we also substitute nga mga objects nga pwede na to ma-use in order for them to perform activities better. So let's say no under dressing unsa may mga pwede magamit nga mga objects or mga technologies or adaptive na mga equipments na magamit for dressing. Sige daw. Can you type lang? Anyone? Okay, that's right. Velcro strap, dressing stick, sock aid, okay, reacher, button aid. Okay, all of those are correct, no? So, mauna na siya itong maingon na adaptation. And then, mga assistive devices, di ba, when bathing daw, sa may mga magamit. Can you type sad? May mga magamit for bathing activities. Okay. Sige, mga long-handled sponge, that's right. Sad. Okay, bath chairs, handheld showers. Okay, all of those are correct, no? So, that's it. Okay, so I think kahibaw na jud mo inside difference between adaptation and compensation. So now let's move on with prevent. So more on disability prevention ni siya. And we address the needs of the client with or without disability because we can prevent disability or further disability man with clients with or without kanang a condition. Sige daw. So, kinsa pay wa katubag mga kog example from naa si Donna Jane Yabo. Donna Jane Yabo, can you give me an example of OT approach or OT intervention approach nga nagamit og prevention? Yabo, nara si Yabo. Okay, joint protection. Okay. Okay. So, joint protection program mention as well. Okay. Actually, si Yabo, no? So, pwede na siya in lifting techniques, which is under pwede workplaces para workers, pwede na programs no in order to prevent mga injuries sa mga nagtrabaho adto. So, apil na teaching sorry, nawa ko kadiyot. So, under prevention po no mga posture or proper posture para sa atong guards para ma-prevent nila ang kanang mga pain or muscle aches nga pwede pod mahitabo sa ilaha. So, okay, yes, proper ergonomics can be as well sa mga office workers and ana. So, anything mo prevent og further nga disability or mo prevent og like start of a disability will be under those prevention OT. So next we have, okay, thank you everyone for answering. So next after sa ato ang planning, that's when we start with the implementation na. So as I've said no, lain pud kayo og magplano ra ta pero wala tay action. That's when ato nag atong plan sa ato ang client. So when we say intervention implementation, we may focus on a single aspect lang. So pwede no specific occupation sa client ang atong i-target or na mga performance patterns or performance skills ang atong i-target as long as kanang part siya in order nga makabuhat ang client sa ihang daily occupations nga meaningful para sa iya ha. So when we say we may nan ni siya magnino nga dili na nato ma-improve are interrelated. So when we say for so while improving memory iyang let's say meal preparation baron na occupation pod nga nagkalisod siya. So it's lagi siya dynamic nga flow. Okay, sorry. Sige. Okay, I'll try to turn off my cam. Sige, so again no when we say focus on a single aspect no wala na ta nag-try aspects because in reality ang atoang domains are interrelated ug nag-influence sa each other. So if mo develop ta og one affected area kay ma-improve na pod ang others. So now let's move on with the steps under implementation no. So first we determine and carry out OT intervention. So di ba mao na to katong with the use of atoang itong nastoryaan na to ganina, mga preparatory methods and tasks, occupations, activities, education and training. Then we also monitor the client's response to the specific intervention. So this will be the basis no kung mag-evaluate ba ta or reevaluate. Let's say for example, tunga-tunga sa atong intervention, dili di ay ganahan or dili di ay haom or appropriate sa client ang atong nabuhat na plan. So, we can try and tan-aw and always ask the client, always ask for their feedback if kumusta man ang activities or kumusta man ang atong like flow sa atong intervention, ma'am. Is it leaning towards unsa imuhang ganahan or not? So, you also, again, it's a collaborative process. So, you monitor as well the client's response and dili lang kung unsa ang ato ang na-think nga maayo for him or her. And then lastly, we have the intervention review. Okay, so the intervention review, this is again a continuous process of re-evaluating and reviewing ang intervention plan, no? So kung unsa gay ang atong makita, next slide lang kami kayo please. Kung unsa gay atong makita no na tarong or dili tarong or appropriate or inappropriate for the client, ato ang i-change or i-modify. So when we say intervention review, this may lead to change. No, it will be a constant sa inyuhang intervention plan kay na ay sometimes no na maglahi-lahi target and then maglahi-lahi pud ang approach na angay nato matarget sa client kay daghan og mga factors na ma-consider dapat. So ang steps ani is first you evaluate kumusta man ang plan, how it is implemented and relative ba ni in achieving your outcomes nga you think sa inyong intervention plan. And then next, you modify if needed. And lastly, you determine the need for continuation or discontinuation of the OT services or kanang i-refer ba ninyo to other services to help him or her improve. Okay, so again, no, you have your plan, implementation, and then review. Then next, we have outcomes. Okay, there you go. So, ang atong outcomes, we all know that outcomes are the end result. So, kung unsa ato ang ganahan and unsa ganahan sa client na mahitabo sa ilahang pag-join og occupational therapy. So, pwede pud ni mo relate sa subjective impression sa client no kung let's say ganahan ba sila nga mas confident sila, mas self-efficient, mas resilient sila sa ilahang own way. So, pwede po na inana no more on their perception lang. And then, it can be modified during the intervention, implementation, and reevaluation. So, when we change our implementation during the implementation review, we can also revise kung unsa ang ato ang target outcomes na ganahan or ganahan with the client. And then the steps of this is first, we select no the outcome or kanang the type of outcome na makuha nato with the client. So this should be from what was mentioned ninyo ganina, it should be valid, reliable, and sensitive to change, and of course congruent with the client's goals. And then next, we use the outcomes in order to measure their progress. So diba, very important na objective and measurable ang ato ang goals. So therefore, um, needed ni siya para ato ang ma-compare ang progress, and then we assess if naabay need nga i-adjust nga goals or interventions or i-modify in order for us to maka-help pagyud na mo progress ang client. And then next please. So nanata sa mga outcomes of OTs, no? Or OT. Okay, sorry, nag-load. Okay, so tara ato ang occupational therapy outcomes. So lahi-lahi ni siya. So starting with our performance. So kung moingon tag occupational performance, from the name itself, mahibal-an nato nord, it's the act jud of doing and accomplishing a selected action or occupation. So to be able to perform cooking, to be able to perform dressing, and ana. So under it, it has improvement and enhancement. Sige. I'll call someone no to differentiate improvement and enhancement. Daratan, can you tell me the difference between improvement and enhancement under occupational performance?
Ang improvement kay murag to make it like better through through like whatever gina-improve, and then enhancement kay more siya touch up or like add to like wait more siya
Sige lang. Unsa man ang present ug not present ani nila? Sik maura ang main na difference.
kuan wait, so kuan na like basically improve kay like make something work better, and then ang enhance kay kung unsay naa kay muna na ang ikuan like muna na ipa better.
Okay, sige, sakto sa when we say improve kay i-make better, so meaning naa siya'y limitation nga present. So enhancement gali same gyapon na atong gitry og increase ang something nga naa na sa iya ha, pero lang ang difference is limitation is not present. Sige, so thank you Daratan and Marky for messaging. Sige, so example for improvement no is kanang mga naay let's say people, so they have limitation with how they perform their activity. So we try and improve ang ilahang attention, ang ilahang like sitting tolerance baron, ang ilahang way no nga mo comprehend sa ato ang isulti sa ilaha, mo grasp og information or mo grasp og instructions na gihatag sa ilaha. So that's one way that we can improve them. So there is a limitation, but pwede na itong ma-increase ang ilahang occupational performance in a way na mag-give ta og activities or interventions na makapabetter sa ilang situation. So in enhancement, murag ararata nag walay limitation, but ato ang gitry og better gihapon. So same gihapon na atong gitry og better ang ilang performance, pero lang walay limitation diri sa enhancement. So examples of this, mga increasing opportunities no for older adults to participate in community. So pwedeng let's say kanang ato ang mga free shuttle to give them time para maka community mobility in ana, diba? And then providing activities for them, let's say vocational or leisure activities for them to increase their opportunities na maka join gihapon ani nga mga activities. Next, we have prevention. So prevention as an outcome is more on kanang identifying, reducing, or preventing onset or incidence of risk factors, conditions, and injuries. Okay, so it's kind of the same with your intervention approach, no? Okay, can someone give me an example of unsa ang example under prevention? I'll call someone na lang. Marie Antoinette Lariosa.
Leisure activities, miss, also kanang mga drug prevention programs in employees.
Kids. Okay, that can be no mga inana nga mga example. So pwede pod no mag-give ta og mga in order for the client to have mga since outcome man, so more on unsa ang gawas. So mag-give ta sa client with cerebral palsy or those with mga behavior issues o appropriate na mga okay healthy eating o pwede pod in ana no, but again going back sa example, mga give og client og appropriate mga areas para dili sila ma-prevent ang injury nila, no. So for example, active or those who don't know pa mga unsa gyud ang safe and unsafe. So let's say ang outcome nato for him or her is to provide an area nga maka-perform siya sa iyang play activity safely and ana. So that can be one, and then also maghatag ta og mga educational nga activities, no, for adults with mental illness in ana, to prevent og further nga conditions. Okay, providing proper positioning techniques, prevent fatigue, etc. So that can be as well. So when we say health and wellness, more on giving resources for daily life. Sige, so can somebody tell me unsa ang meaning sa health and wellness? Health and wellness.
Try ko like, for health kay wherein specify or siya og like pwede siya ma-specify for physical, for social, for emotional. However, for wellness, this caters the overall about the health, like tanan na adyo diha.
Okay, can be no. So thank you, Christy. So when we say health gali, more on katong mga physical, mental, and social well-being of the person. But when we say wellness, mershag from the book, no, it's an active process through which an individual become more aware and make choices towards a more successful existence. So more involved na ang individual in order to achieve ang katong iyahang a good state of physical, mental, and other aspects sa iyahang well-being. So again, health and wellness, mao na siya ang difference. So when we say health, state of physical, mental, and social well-being. But when we say wellness, the client is more involved na or active in the process of becoming aware and making choices in order to achieve ang kanang better nga existence. So can somebody give me an example under health and wellness? Okay, wait lang. Sige. Toriaga Sweet. So until 10 raman mo. So when we say health and wellness, no, example lang nga paspas is more on kanang like making choices nga para sa inyuhang health no, ang inyong obesity and the likes. And then we also have quality of life, participation, role competence, well-being, and occupational justice. So you can read more about it on the internet or in your kanang OTPF. So Okay, so I hope you learned something from our discussion for today. So ang ato yung gist anino is that our evaluation, our intervention, and our target outcomes are kanang interrelated. So if evaluation, we use it in our intervention plan in order to come up with an outcome na made collaboratively with the client and the therapist. So as much as possible, if na I change in any of these areas, kay ma-change pud ang others, and this is a continuous process. So as much as possible, you evaluate and reevaluate your clients properly. So Mikay.
Okay, so we have the last 4. So 10 naman, no? So, i-brief lang naman i-discuss. So again, sunod, we have participation, wherein we engage in desired occupations, well-being, contentment with one's health, self-esteem, sense of belonging, and etc. Role competencies meet demands of roles, and then for occupational justice, this is the access to and participation in full range of meaningful and enriching occupation. So for participation, examples can include um, children having kanang access to kanang programs. For role competence is basically the roles na naa sa client. So kunyari, example kay um, a child na nag-eskwela, so kailangan niya na i-meet na role or dapat na niya i-meet na nga demand, which is na siya sa school age. And then for well-being, well-being kay murag more on contentment man. So nakontento siya, though naa siya sakit, kay kontento na siya siyang life, kay na-maximize ang iyang independence. And then for occupational justice kay kanang someone with intellectual disability na murag na-offeran siya job or na-offeran siya kanang program sa ilahang community. So, mao na for our outcomes. Okay, here, naara pud sa OTPF3 atong OT process. And that's it. Thank you, guys. Do you have any questions before ta mo end? We're naka-extend jud og 6 minutes, no? We apologize. We didn't know na to 10 ra mo.
Okay. So, na-discuss naman ni Miss Rubik o Miss Sanchez ang tanan. So, sabot naman sa mo to kay kapila naman ta magsigbalik-balik sa OT process. So, ako lang hangyo next time if ever gay nga pa-answeron mo, bahalag dili mo maka answer like on mic. Pwede lang mo chat, okay? Kay marag nakabantay na ko nga mag-off cam na gay mo niya. Guman, if pa-answeron mo, di pa yun mo answer. So, palihog lang next time ha. Okay, so for today, katong wala ni answer, God bless. Okay? So, thank you kayo guys. Mao na to ang kuan for today. Okay? If ever wala na questions, then thank you. Bye!
Thanks, sir. Thanks, mga mess.